then today, inshallah, we're going to be speaking about treating the whole person and finding the root cause of disease, right? Now we have to talk about the word, if you look at the flyer, I use the word dis-ease, not disease, so I put a little dash in between because dis-ease is any type of ailment that an individual has. It doesn't have to be, in the ICD-10 code book or ICD-9 or ICD-10 code book where it says, this is a disease that's characterized by X, Y, and Z, but any type of deviation from optimal health. And when I talk about optimal health, I don't mean like, I'm not in the hospital, so I have optimal health. Or I wake up in the morning, alhamdulillah, I have optimal health. And if you wake up in the morning, this is a huge reason to have, to be thankful to Allah subhanahu wa ta'ala. But the goal is to be optimal, meaning when you wake up in the morning, you have 10 out of 10 energy. You pop up out of bed, 5, 6 o'clock, you should have a decent amount of energy. You have no pain in your body. Your mind is there, you're very focused, right? You have full range of motion throughout your whole entire body. When you eat food, you digest it properly, you digest it well. You have bowel movements that are normally once a day, easy to pass, right? As well as, different social interactions. Your anger is in control, right? Your sadness is in control. You have the ability to cry. Some people don't have the ability to cry, period. Very difficult for them. I've had patients come in and say, I don't remember the last time I cried. Sad event after sad event went on in their lives and they can't muster the energy or the emotional power to even shed a tear, which is something that the Prophet ﷺ did. So whenever we're talking about dis-ease, we're talking about any deviation from the idea of optimal health. Now let me speak a little bit about naturopathic medicine. I'm a naturopathic doctor. Basically, I went to school here at University of Pittsburgh, did my undergrad here, moved to Chicago. There's a school out there, National University of Health Sciences. They have a 4-year degree for naturopathic medicine. I've been studying there for 4 years. And now I'm actually practicing out in the Chicagoland area, and inshallah I'm planning to potentially start a part-time clinic here. Naturopathic medicine, the first 2 years, is basically the same as any other school of medicine, osteopathic, allopathic medicine. You learn biochemistry, physiology, anatomy, all those topics. The second 2 years, when you get a little bit more into the clinical sciences, how to actually treat the patient, you learn a little bit of a different philosophy in a different way, a few different modalities or tools that get put in our toolbox compared to allopathic or osteopathic medicine. We use a lot of herbs, nutrition, physical medicine, and we'll be talking a little bit about that today. When you're looking at finding the root cause of disease and treating the whole person, there are three aspects to an individual and 3 factors, main factors that can cause disease in the body or dis-ease in the body. One of the factors is structural. So this is basically called the triad of health. You have a triangle, and on the base of it is the structure, right? So if you're structurally misaligned, or you have some type of tension in your muscular system, or you have something called a hiatal hernia where the stomach is actually pushed up into the esophagus, that can cause a lot of symptoms, right? So the structure has to be there, right? The second one is mental emotional. So if you have mental emotional stresses, it can cause a lot of symptoms in the body. So if we're all sitting in this room and I tell you there's a bear that walks into the room, even whether or not the bear is there, everyone's cortisol will start to go up, and it will immediately have an effect on your whole entire body. I can start drawing blood up from people right now and see that the cortisol level is high, right? So that mental emotional is a reality. So when people come in, they have stressful home environments or work environments, they put a lot of stress on themselves, whether it's necessary or not. That can have a huge impact on health. Sometimes people get traumatized, at childhood traumas and things like that. They can haunt them for years and years and years, right? So that's the mental emotional. We'll get a little bit more into this as well. So that's the second, and this is in no order, of course. But the third is biochemical. And we spoke, for the most part, about biochemical because this is something that I teach my patients, and they can take this information home and apply it immediately on themselves, right? So, and that includes what you eat, what you drink, what you're breathing, right? The air quality in your home, the air quality outside, and also any medications you're taking or anything like that, any herbs, supplements. So that falls into the biochemical. And obviously, everyone understands, right, how if you're consuming something, like if I'm eating nails, I may have pain in my stomach. That makes logical sense, right? Or if all you're eating is rice and your skin is breaking down because you don't have enough protein to rebuild it, right? It makes sense that that's going to happen, right? It's just logical. So the biochemical side is the third side of the triangle. So you have these three things, the structure, the mental emotional aspect, and the biochemical aspect. And these three, if any side of the triangle is kind of shifted out of place, it can cause dis-ease or disease for an individual. And when we treat people, we look at all the different factors. Now, for all of you here, the goal is for you to take this information home that we're going to talk about. Inshallah, we'll have some examples as well, and to start applying this and the information from the first three lectures in your life, so that you can decrease the chance of any of these three sides of the triangle being shifted out of place, and to bring you closer. Even if you don't have any disease right now, you're perfectly fine. You don't go to the doctors because you feel like you have good health. You're young, you know. There's still things that you can do to kind of optimize yourself.